Maximum dose sounds like the finish line. Ozempic, Semaglutide at 2 milligrams, or Mounjaro, Tirzepatide at 15 milligrams. But many people never need to reach it. The right dose is the lowest dose that delivers enough blood sugar control, useful weight change, and tolerable side effects. Going higher can help, but the extra benefit may be much smaller than expected. Ozempic copies one gut hormone signal released after eating. Mounjaro copies that signal plus a second related signal. Both help the pancreas release insulin when blood sugar is high. They also lower glucagon, a hormone that tells the liver to release sugar. Higher doses strengthen the same effects without changing how the drugs work. Stronger signals can produce more benefit, more side effects, or both. Your results depend on your starting blood sugar, other medicines, diet, and how your body handles the drug. Your goal is not to climb the dose ladder fastest. It is to stop where treatment is doing enough for you. The official Ozempic schedule starts at 0.25 milligrams weekly for 4 weeks, then rises to 0.5 milligrams. If more blood sugar control is needed, the dose may rise to 1 milligram. After at least 4 more weeks, it may rise to 2 milligrams. That is the adult maximum dose. Mounjaro starts at 2.5 milligrams weekly. This is a starter dose and is not intended to provide full blood sugar control. After 4 weeks, it rises to 5 milligrams. Further increases come in 2.5 milligram steps, with at least 4 weeks between steps. The adult maximum is 15 milligrams weekly. Both schedules say to increase only when more blood sugar control is needed. The dose ladder is not meant for automatic increases to speed weight loss. If your blood sugar is controlled and side effects remain manageable, staying at the current dose may be the better choice. Do not compare the milligram numbers between these drugs. 15 milligrams of Mounjaro is not 7.5 times stronger than 2 milligrams of Ozempic. They are different medicines with different dose scales. Milligrams only compare amounts within the same medicine, not power across medicines. A higher number on the pen does not guarantee a much larger benefit. In one 40-week Ozempic trial, 1 milligram lowered A1C, the roughly 3-month blood sugar average, by 1.9 points. The 2 milligram dose lowered it by 2.1 points. The extra average reduction was 0.2 points. That extra 0.2 points may matter when your A1C remains above the target set for you. It is not the dramatic doubling that the dose numbers might suggest. Average weight fell by 5.6 kilograms with 1 milligram and 6.4 kilograms with 2 milligrams. The study did not clearly prove that the 0.8 kilogram difference was due to the higher dose. Mounjaro gives another example of why a higher dose does not always produce a larger blood sugar drop. In one 40-week trial using the drug alone, a 1C fell by 1.8 points with 5 milligrams. It fell by 1.7 points with both 10 and 15 milligrams. Those small average differences do not prove 5 milligrams is better. They show that the dose number alone cannot predict your result. Weight moved differently in that same trial. Average loss was 6.3 kilograms with 5 milligrams, 7 kilograms with 10 milligrams, and 7.8 kilograms with 15 milligrams. Higher doses produced more average loss, but a higher pen number does not automatically mean more treatment is needed. If your blood sugar is controlled and your weight is still falling, another increase may offer no clear benefit. A higher dose can cause nausea, constipation, fatigue, or make you eat too little. More medicine can add problems to your day while improving your results very little. A lower effective dose may protect your daily function better. You may have the opposite situation. Your blood sugar remains high, appetite control is weak, weight has stopped changing, and side effects are mild. After enough time at the current dose, a careful increase may be reasonable for you. A dose that is too much for another patient may still be too little for you. This contrast matters because side effects are not proof that the drug is working better. Nausea, vomiting, diarrhea, constipation, stomach pain, and reduced appetite are common with these medicines. They often become more noticeable during dose increases. If you cannot eat normally, that is not a treatment success. The 4-week spacing has a purpose. It gives your body time to adjust and gives the current dose time to show its effect. If you increase too early, you may mistake a few hungrier days for treatment failure. You may then increase again before giving the current dose enough time. Tolerating your last injection does not make the next increase necessary. 3 results matter more than the pen number. They are your blood sugar control, your weight trend, and side effects that affect your daily life. A few added safety checks guide that decision too. Start with your blood sugar. Your A1C trend gets compared with home blood sugar readings before breakfast and after meals. One high reading does not prove your dose has failed. Repeated patterns show whether blood sugar stays high or another part of your plan needs attention. Your weight trend comes next. One flat week can come from extra body water, constipation, salty food, or normal scale changes. A sustained trend over several weeks is more useful. Continued gradual loss means your dose is still working, even when the dramatic early drop has slowed. What the benefit costs you matters just as much. Persistent nausea, severe constipation, dizziness, or eating too little can make a higher dose work against you. Your weight may fall while your strength and daily function worsen. That is not a clean win. Insulin and certain diabetes pills also factor into this. If you use insulin or a sulfonylurea, an older pill that increases insulin, be careful. They can lower your blood sugar too far on their own. Raising Ozempic or Mounjaro may increase that risk. Adjusting the other medicine may matter more than raising your Ozempic or Mounjaro dose. Severe stomach symptoms require a different response. Contact your doctor promptly for persistent severe stomach pain, repeated vomiting, or inability to keep fluids down. Do not increase the dose until the cause is clear and you can keep fluids down. When severe symptoms are absent, your weekly routine gets checked first. Missed doses, irregular timing, large changes in eating, or becoming much less active can make the medicine seem less effective. A higher dose cannot reliably repair those problems. It only puts more medicine into your body. Your current dose usually stays the same when blood sugar is at target and side effects are manageable, with weight also moving toward your treatment goal. An increase becomes worth considering when your blood sugar stays high after enough time at the current dose. That increase only happens when your side effects remain manageable. A maximum dose can still be exactly right for you. You may need 2 milligrams of Ozempic or 15 of Mounjaro. That dose is not the problem. The mistake is making it mandatory or calling a lower dose a failure. The best dose for you is not the highest dose you can endure. It delivers enough benefit without side effects that disrupt your daily life. Blood sugar targets, weight trend, and daily function are what decide it. Your results should decide where the ladder ends. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.